Welcome to the Friends of NPACE podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com.
Hi, everyone, and welcome to the Friends of NPACE podcast. You know who I am. I'm Terri Schmitt, the Executive Director at NPACE, and I am so excited as we are continuing on with our entrepreneur series for APPs. And my guest today is an expert. She's amazing. She's such an advocate in that area, and I'm so excited that she agreed to take some time to be here with us today. Today we have Dr. Lynn Rapsilber. She is so impressive. You're a nationally recognized advocate for nurse practitioner entrepreneurship. You're a founder and NP Business Consultants, LLC, to address gaps in NP education around reimbursement, coding, documentation, all of those things they don't really teach us in school. Co-founder and CEO of the National Nurse Practitioner Entrepreneur Network, NNPEN, as we know it. You champion financial viability for NP-owned practices and elevate the nursing model in healthcare, which I think is just so important. You earned your DNP in nursing leadership from I'm going to say this wrong, Quinnipiac University.
That was perfect.
Oh, great. Okay. And you received the Transformational Nurse Leader Alumni Award from there in 2017 because you are transformational. But where our audience might know you besides an NPEN is you've led Connecticut's APRN Coalition to Full Practice Authority in 2014. You are a past policy chair for AANP. You're a fellow of AANP and a recipient of the Nightingale Award and AANP Advocate Award. You are everywhere advocating for NP practice. And you currently own NP Wellness Care, which provides hepatitis C treatment in addiction recovery settings. And we've been so lucky to have you talk about that business model at some of our events. And so I'm just grateful. Did I miss anything? Anything else you want to tell us?
Well, we want to get to the meat of the discussion, so enough with my resume.
But it's so good. It speaks to why you're here. All right, I asked you here in this entrepreneur series because an NPEN is doing something new. So I do want you to talk about an NPEN briefly for our audience that doesn't know that, but what is an NPEN and what are you doing now? That's going to be really important to practices and patients everywhere.
Well, thanks, Terri, for having me. I have a fond place in my heart for NPACE. We've had many opportunities to work together, which I really appreciate. And I love the fact that you're shifting towards the entrepreneur and really paying attention to a lot of what their needs are. That's what NNPEN is all about. We started because we recognized that we were not getting business education or training nowhere in any of our nursing programs, but especially when you want to become an entrepreneur, you really have to have a good foundation of business to really be successful. And I know so many people I've spoken to said they wish something like NNPEN was around when they were starting their businesses, because maybe, number one, they probably wouldn't have made some errors in, selecting things or partnering with folks or whatever, but that they also would have community. And that's one of the things that we're striving for, is to create that entrepreneurial community. And we've done it by focusing on business education. We have a Business Basics Accelerator course that will give you the foundational support in a community of other cohorts from across the country that are trying to learn about business and start their own businesses. So that's one thing. But we also have a lot of other education programs. We have a lot of partnerships with folks who understand that nurse practitioners want to practice in the nursing model, which is different than the medical model. And we also are trying to reduce some of the barriers to practice, in addition to enlightening folks as to some of the policy issues and how they affect an entrepreneur. In particular, the government shutdown. I put out a nice one-pager to our members talking about what was going on and how they needed to position themselves for the potential of a government shutdown, which we know it happened. So then I resent out the email again, just as a reminder to members about what they need to know to protect themselves. So that's NNPEN, our for-profit side. But we recognized we need to do more. So
what's going on? What did you start?
So we started a 501c3 called Destination NP. We recognized that we needed to allow us to have a 501c3 for a number of reasons. The first being we wanted to create a database for nurse practitioner entrepreneurs, and that was up to date, and that patients could find nurse practitioner-led practices for specifically NP-led care. And then nurse practitioners could find each other for collaboration, for referrals, because we all want to sustain each other's businesses, but also resource sharing. You may want to partner with another NP to share real estate, for example, or service lines, et cetera. And then students who want to find a nurse practitioner entrepreneur to precept them. And eventually that could become, another employee in your practice. So those were the three tenets of our directory. It's www.mpdirectory.org. But we made it a 501c3 for an additional reason. And that was because we know NPs do not have access to capital. And as for-profits, they can't apply for a lot of grants because they don't issue them to for-profit entities. So as a 501c3, we could become that grant administrator for that practice. They can apply for the grant under Destination NP. The monies would come to us and we would give them back to the practice owner so they can use them for whatever they need for their practices. So that basically is the premise for the NP directory. But one of the reasons why we started it as well is because we know there's practice owners across the country that are doing fabulous work, but we don't know where they are. They're doing it in isolation. But what I'm finding now, we're finding pockets of business owners that are meeting in states, and they're finding out about us and they're starting to join us. So this is going to be quite an opportunity to leverage the power of the collective voice of the NP entrepreneurs.
I love that. You and I both know this arena is growing, right? So as messy as healthcare is right now, it's a beautiful time for opportunity for advanced practice providers. Like, we are part of the solution to all of this. And so even if we grow, if we grew nationally by 1 or 2% that were doing business, that's like doubling and tripling how many people own their own stake in their own practice. I love that. I love you're helping.
Just like the fact of, incident to billing makes the NP invisible in the billing space, while not knowing where our NP practice owners makes them invisible. And, this is why now more than ever, we have to come out of the shadows and really put a spotlight on all of the good works that we're doing in the communities that we serve, especially in light of what's happening in potential cuts to services. And, how are people going to get access to care when there's not enough primary care physicians? It's just, there's so many moving parts right now. And the beauty of what NPs do as practice owners is they find needs in their community and they want to support that. And so that's a great basis for starting to figure out what they want to do as a practice owner. Find the needs in your community and problem solve.
Yeah, I love that. So we know how to find an NPEN. Does Destination NP have its own website, or do we just find you through the NP directory? I'm going to go look that up, by the way.
Yep, www.mpdirectory.org. That's the site for Destination NP. And when you click on it, it'll ask if you're a patient, if you're an NP, or if you're a student, and you click on the appropriate box. The easy thing, though, for an NP is all you need is your NPI number. It pre-populates everything in there. So in a matter of a couple of clicks, you'll have your information there. And if you do have a practice, you can put in that information as well, and you'll get a pin on a Google map. So now people can find you.
Oh, I love that. So anyone can join. This is not like a ZocDoc thing. You can put yourself out there. Patients love their NPs, and they will fight to keep them or find them if their NP quits or moves.
I think that's the other important thing that we have to pay attention to, is that our beneficiaries out there, our patients, are going to providers, and then they're being told, well, that provider's no longer at that office, and they keep moving and moving and moving. At least when we're our practice owner in our community, we're a source of stability for the patients and their families. And I think that, and the community. And so I think all those are really good reasons for why it's time for us to start thinking about entrepreneurship.
Yeah, I like that. You had a call out for NPs. You said it's time to come out of the shadows. You and I have had a conversation about NP colleagues who don't want to do that. They're in states or areas where they're afraid they'll be targeted then by the Board of Nursing, but or the Board of Healing Arts or Medicine. That was how it was 20 years ago. Do you think that's still the same or
I
no?
do think that there's still challenges, but I do believe that because our numbers are such, and I believe that there are much more NP entrepreneurs out there taking care of a large number of patients. If you think about it, a nurse practitioner who has 250 to 1,000 patients isn't going to have a lot of leverage. But if that NP, if we had 1,000 of those
Right.
NPs, that gives us a lot more leverage and power. And I also think that because NNPEN is also in the protection of the NPE entrepreneur space with policy and advocacy, we can start helping some of the states at the state level with some of these issues if we just knew where you were, how, where you are, and we can start to help because we're starting to form state liaisons as well, state affiliates to NNPEN. And that's been very exciting because
Oh,
we're
nice.
seeing some challenges, especially when it comes to reimbursement. Some of the Medicare Advantage plans are terminating contracts for NPs, which is for no cause, which that's upsetting. And then we've heard recently about the issues with potential downcoding of visits. And that has to be against the law somehow because we're responsible for what we document, code, and bill. And why does the insurance company get to downcode something they haven't even looked at? But the more of us that can band together, the more our voices can lend power to a message saying, we're not going to put up with that.
No, I think that's really good. I cannot imagine Medicare Advantage just wiping off nurse, but who do they think is going to give the care? Like, I just don't
AI,
understand. Oh, but
which is, yeah,
oh,
that's a whole nother
oh,
topic.
let's talk about that sometime. Although AI is great, I'm not going to bash
Mhm.
it. I think we
Yeah.
need it. I love it when it takes meeting minute notes for me and combs through my calendar. But I agree. The other thing too in state to state policy is things like some states not being able to write certain DME and in other states you can't. Like that's ridiculous. If I'm
Yeah.
providing all the care, I should be able, or the home health orders or the whatever.
Yeah. I wish when COVID hit that we couldn't keep those waivers, giving us, but you taking away all those barriers to practice. I wish that that had lasted and that we didn't have to deal with these state by state issues anymore. It's very frustrating as a practice owner to try to, fight off some of these barriers to practice. But again, if you're doing it in isolation, that's one thing. But if you have a whole team and a community behind you, it makes it less problematic. And knowing that, some of these things that are happening are going to have a direct reflection on the patients that we provide care to, we have to fight for that. Uh, Trying to cut people off who are getting home visits. And, these are folks that have been stable. They're out in the community. We've reduced ER visits, urgent care, and hospitalizations because we're going to their homes. And so I think sometimes the insurance companies are a little short-sighted in seeing the value that what an NP practice owner could bring to the table, frankly, because they don't have us have seats at the table and they don't ask. And, it becomes very frustrating at that point. So again, the more that we can unite and band together as practice owners and entrepreneurs, that will give us a lot of leverage and a lot more power in using our voices to change some of the things that are happening out there.
I like that. Yes. And for grant funding, state to state or whatever's out there where they are. So is it working already? Share some stories from the field. Are people looking up and using? Are we connecting with NPs?
So we just started in March and we
Okay.
have over 300 on the platform right now. So it is still new. But I would encourage people to sign up and get your name on there so we can start leveraging the capabilities of the platform. It's nice because we're finding that NPs are connecting with folks near in their communities. And some folks have not even realized that there were people in their community that they could start to network with. So I think we're making some of those connections now, which has been very helpful. We're also getting interest. We were just at Health Dr. Lorraine Bach and I were at Health, and that's a healthcare trade show. And we actually were talking about the directory and the power of our collective data that could be available for expert opinion if we have software developers that come to us and say, hey, I have this great new tool or app, I want to beta test it. Do you have the folks that we could call on? The directory can be an integral part in that process. And so we can actually start to drive changes in healthcare too by being on the platform. And the fact that it's a 501c3 means we are not going to sell this. We're not going to give it to venture capitalists. It is going to be governed by the folks that are on the platform. So NPs built it and NPs will own it.
I love that. That's so great. In your work with all of these NP entrepreneurs, the ones you're interacting with, like, what's the driving mission and what's the consensus right now in the field for owning a business? Good time, bad time?
Oh, I think it's a great time to be a practice owner. I think part of it is people need care and they're having long wait times for a lot of places to provide that care. They see the needs in the community and they want to help. I do find that people are concerned about reimbursement and how they're going to get paid for the services they provide. And I know a lot of folks are gravitating towards cash pay services, which is great if somebody can afford that. But the nice thing is that if we do a balance between Medicare and Medicaid, plus or minus Medicaid, and then some member subscription, maybe a per member per month rate, and then add on some cash services like weight management, for example, or veterans disability rating exams. There's a lot of ways to balance out your practice portfolio so that you can stay solvent. So we work with our NP entrepreneurs to give them those tools to make sure that they understand how that works, so that they can make really good decisions about their payer mix and how that they stay afloat. Because the last thing we want is a practice to not survive in these times of need.
Yeah, and I think that's probably the biggest fear, right, for those nurse practitioners and APPs out there. I worry. I see a lot of adult Medicare and Medicaid patients in the realm I'm in, and a lot of rural patients and a lot of ACA funded patients. And I just don't know what's going to happen for those patients in the next 12 to 18 months. They have to have care and they have no extra cash to give to. Sometimes they don't even have cash to fill their meds, but.
Well, and I think one of the nice things about NP practices in general is we're very resourceful. So we find the folks in our community that can help and support us, whether it's a local food bank or whether it's a community bank that can help with some support. There's ways to make a practice work to get the services to the patients as much as we can. And I do think that it's interesting because when you listen to how physicians want to help change the landscape of primary care, they're all about direct primary care, which or concierge. And a lot of times that's great, but the amount of money that they charge, the regular person cannot afford that. So we can actually provide care to Medicare, Medicaid, and then do a per member per month, especially for those folks that have high deductible insurance plans. And then, make it reasonable and affordable so that we can take care of them, work with local labs, work with companies to get medications at discounts. So there's a lot of opportunities out there to work with our community resources. Once people find out what we're doing, they do want to support because they recognize that people need care and they are willing to help in any way, shape, or form. So it's just getting people to push play and have the confidence that they can do this and get their business plan going. And
so that's going to lead beautifully into my next question. So you come in and consult for NP businesses. You do it once they're going, when people are thinking about it, like, where do you step into that process?
So a lot of people are becoming members of NNPEN and they do get some consulting time as a new member. Okay. And a lot of times these calls are really to prioritize what their ideas are about practice ownership. Many times I find that they want to open a weight management and then an aesthetics and then a primary care and a this and a that. And it's like, wait a minute, you can't do them all at once. Let's focus on one thing, get you started, and then we'll add on as we go. There are many who want to do remain in their regular job and develop a practice as a side hustle until it starts to gather some traction. We've seen that. Also, folks that have tried to start a business but have stalled for whatever reason. Maybe it's marketing, maybe it's having the wrong electronic health record, whatever the issue is. So we try to work with them. The other thing that we're instrumental in starting soon is a mentorship program. So a lot of our practice owners that take the business basics course want to be paired with somebody to mentor them as they're going through their first year in business. So we're working on that right now as an opportunity. And we also do private consulting. So if somebody doesn't want to take a BBA course, they can bank some hours, consulting hours with us. They'll be paired with Lorraine if they want to become a practice owner, Sandy if there's legal issues or insurance related issues, me for coding and billing issues. So there's a lot of ways to utilize the services that NNPEN has to help NP entrepreneurs. And I do think that we have a lot of content through our office hours that we do the third Tuesday of every month.
Okay.
And that is all recorded and all of that is available. And there are hot topic items such as cybersecurity, how much insurance do you need? How do I add an employee? One of the ones that I think we're going to spend some time doing at our conference in Tampa is when do you have a 1099 and when do you have a W-2? Because there's a lot of confusion about that. So,
well, interestingly enough, it varies state to state and who can define a 1099. So you gotta know your state. Oh, I love that you're going to talk about that. Yes, this for all the listeners, this is going to air after you guys are with us in Florida, but you have an upcoming conference in Florida, and then we're right behind you in Florida. And then the National Pain Management APPS this year. We're all going to be there together for like 10 days.
Yeah, it's crazy. Florida, who is our first state liaison, the Florida Nurse Practitioner Group, they are doing a business boot camp. So they're bringing in folks and it's going to be 2 days of intense work. I'm actually doing a coding and documentation. We're actually going to become an auditor and audit a note so that we can see what goes into writing a good note. And also talking about the financial strategy, getting your business plan up and running. There's going to be a lot of great stories from clinicians who have started their own businesses. So it's really going to be an opportunity to do some pretty good networking. And we're excited. There's over 100 people that are attending this conference, which shows that there's definitely an interest in folks that want to learn more about starting up their own business.
Yep, absolutely. I think it's going to be an ongoing, and I love that you guys are out there providing in this space. So I'm going to circle back to the directory before we ask how people can find you at an NPEN. The directory is npdirectory.org, www.npdirectory.org. Just go in and sign up. Doesn't cost anything. If you're a nurse practitioner, entrepreneur, you have your practice, and you can put it out there on the map. Students, great place to find preceptors. Just saying. We're going to have a student series in this spring. And I think, of course, that's the biggest thing that students struggle with is that preceptor piece. I love that Destination NP is now a birth thing for you. I think that's going to be so great. Any way we can help with that, let us know. How do people find you at an NPEN?
So they can find us by going to www.nnpen.org and look through what we have on our website. If they want to test drive, not sure, then go to, actually tonight we're doing a webinar series on AI, but they can go to the office hours the third Tuesday of every month. And that's free for anybody who wants to, test drive us, see what we do. And then put in a request for a conversation. I'll be happy to spend some time talking with folks. If you're at the conferences, I usually try to have a booth at a conference. So there's a lot of ways to get our attention, but we really want to make sure that we're meeting the needs of all of our NP entrepreneurs. So if there's something that you see, you want us to start thinking about that, let us know too. I'm all ears wanting to find out what our NPs are struggling with and how we can help them be successful. And I also just wanted to share too that I've actually had the opportunity to do some pitches at innovation conferences, and that has been very exciting. I think one of the things that we don't feel comfortable doing is getting outside of nursing and knowing what other opportunities are out there. So doing these pitches has been a really good way of getting the word out about who nurse practitioners are, what we do, and how we're trying to change things. And you made a comment earlier about ZocDoc. It was interesting. I was at a presentation out in Berkeley, and it was my first time pitching. There were 22 people. They picked 6. I was in the top 6. And they asked about the directory, saying, well, there's ZocDoc out there. Why is this any different? And I said, well, first of all, it's a 501c3. The MPs that are on the platform are going to decide how it operates. And I said, it's much more of a bigger entity than just matchmaking a patient with a provider. So it was interesting to get those questions fielded to you and having to answer them, very quickly. And it was exciting. So I'm going to be going to a lot more pitches. So you might see me out there. I'll be posting a lot of those on LinkedIn because I want people to know what we're doing behind the scenes to actually help NPs and push the message of NNPEN forward.
Look at you talking to the tech bro space and venture capitalists. Oh, we should have a class on how to pitch. I think that's great.
Yeah, it was really exciting. And, each time that I'm doing this, I'm becoming more and more aware of what is involved in doing this. And you really have to have the elevator speech. And all of us need to practice our elevator speeches for our practices too, because if you're in front of somebody and you want to tell them about your practice, you only have a couple of minutes to get your point across about who you are and what you do. So that could be another conference. Craft your elevator pitch.
I like that. Definitely everyone should have their elevator pitch ready and really put it to people and run it by your peers and get feedback.
Absolutely. And the other, I don't know if you want to talk about the fact that we're trying to collaborate more on a lot of information around entrepreneurship as well. So I'm very excited for that.
Yes, I think there'll be more coming up. This series is just kind of the tip of the iceberg, but we want to support APP-owned practices. What was so interesting is when I went in and did a lit review, and you and I talked about this, that I think, the percentage of nurse practitioners who have a stake in their own practice or are on record is around 2% nationwide. Physicians, that's a closer to 35%. Our PA family members, peers, nobody's collecting that data yet. And there's 175,000 of them out there. They have to exist, and we need the data. I just don't understand why, no one in healthcare is motivated to get that and keep it.
Well, and the other thing too is we're underfunded. Nursing is so underfunded across the board. And, again, it speaks to why it's important to have a collective voice and to be able to get our message out, because nursing needs to be funded. I'm sorry. Care is going from the hospital setting to the community now, and there has to be more incentive to invest in nurse-led care, whether it's, RNs going out and doing their own practices or APRNs or PAs. We're all vested in our communities now, and that's where I think we're going to have the biggest change in healthcare, because right now, it's not sustainable. Our outcomes are terrible. And we keep, having that shell game about where we're putting money, and it hasn't done anything to improve overall health. So I think the next logical step is getting out of the illness model track and going into the wellness model, which is health promotion, disease prevention, partnering with your patients, which is nursing. And it aligns perfectly with value-based care, which a lot of these Centers for Medicare and Medicaid innovation models are gravitating to. And the nice thing about CMMI is they're looking at NPs and taking down our barriers to practice when they put these programs in place. So that is very exciting. So there is hope.
I think it's an exciting time to be a provider, because in all of these systems not working, we have to find a way that it does work. And we're primed to do that. Definitely.
Absolutely. Yeah. And I think if you know that there are people that have been there before you that are willing to help you, and make sure that you do this in a safe space, that is what matters most. Honestly, you have to trust the people, and nurse practitioners are a hot commodity right now. That's one of my keynote addresses that I've been doing at conferences. and just trying to articulate the message about how important it is to ask a lot of questions, especially if you're new in this space. You need to make sure that you're getting what you need. Do they know what a nurse practitioner is? Do they know what the nursing model is, that it's different from the medical model? Do they employ a nurse practitioner? If they do, if they don't, do they at least consult with NPs? How are they structuring their advisory board? Do they have NPs on that? If the answer is no to any of those, then they probably don't have your best interest. So I would walk away from something like that.
I think that's really good advice. And yes, we definitely need more NPs in the communities, kind of anchoring the community. I think it's really important. Yeah, I appreciate that you're doing that. Go ahead.
I was just going to add that NPs create unique business model opportunities. I think the other thing that stops people is that they have to do a brick and mortar, and that is so not true. Our NPs are going into patients' homes, they're going into daycare, schools. We have one person that's a primary care for a mega church. I mean, there's just so many different opportunities. Go to employers, small businesses. There's a lot of ways to create your patient base in unusual ways. It's just thinking outside the box and knowing that you can do this.
Yeah, that's exactly what you're doing with your hepatitis C practice, right? Like going into these inpatient and outpatient, even rehab centers, and helping them manage these patients. And I think it's just genius, because many of them don't have 24-hour clinicians, or if they do, they're psych mental health. They're dealing with other things, right? And not.
Yeah. And if we can get the hepatitis C cured, which we can, they're in a controlled environment. We know they're going to take the medication. Then they start to feel better, and then they can focus on the other things that they need to change in their life. And that is just so rewarding. And none of these people that I'm treating would ever be treated outside of the walls, more than likely, because you can't get an appointment. Who takes their insurance anymore? If some of them might still be using drugs, which we know that if you treat people who are injecting drugs, you prevent the spread to 20 other people. So there's just so many good things that can happen when you intervene early and get them to a point where they feel that they can be empowered again.
Yep. And it's definitely an outside the box model, like we were just talking. I can hear your passion in your voice about helping these patients become hepatitis C free. And once a nurse and a nurse practitioner, always, right? We're always trying to make the patients better. That's what we do.
Absolutely. But, to that point, we also have to understand that we're business owners, that we're revenue generators, that we do not have to give away our services, that our services have value, and we have to be able to articulate that in some fashion. And I'm not saying that we don't charge some people. If you want to give away some care, that's okay. But I think for the most part, we have to be able to understand that it's a business, and in order for the business to survive, you have to make some revenue. And how is that going to happen, and what's that going to look like, so that we can keep the doors open and the lights on and keep that practice going. So again, it's a lot of getting the value for the money that you are spending. And I think our patients get plenty of value from NP care. So I think we just have to be in a mindset that we have to start thinking like a business owner. We have a heart of the nurse, but a mind of a business owner.
I love that an NPEN is out there helping us. Like, nobody wants to go back to school and get an MBA and still might not get what they need to get to run a healthcare business. So what you're doing is really important work. Yeah, well, thank you. So we know where to find you now. We're going to find you at the NP directory or at an NNPEN. What's the NNPEN website?
NNPEN.org, NNPEN.org.
Okay, we got
and
that.
NPdirectory.org. So we try to keep it
Simple.
easy to remember. Yeah,
I appreciate that. Good. Well, we're going to see you more in the upcoming year and things that are going on, and maybe we'll run into you in Orlando, but the audience will let you know how that went because you're not going to hear this until afterward. Thank you, Dr. Rapsilber, for being here, taking time to join us, being a part of this series where we encourage people in their business ownership. And thank you for starting the NP directory and the 501c3. You're a busy woman. Tuesdays, third Tuesday of the month, they can find you at office hours. What time of the day is that?
So that's 8:30 Eastern time.
Okay.
And we do record them all, so they're on our website after the time. But if you're there that evening and you decide to join us or you're already a member, you get a free CE. So you get 12 CEs a year just by participating in those. So
I love it. That's so great. All right. So audience knows where to find you. Thank you all for being here for this. And you can find Dr. Rapsilber all over the place. If you are a member of AANP, you can find her there. She's very involved. She's very involved in the fellows and just a fantastic nurse practitioner to have and to know. NPACE is an ANCC accredited provider. We now also have CME with AAPA at our live events, so you can find us there, all things www.npace.org. And thank you so much for tuning in. This concludes our Friends of NPACE podcast for today. Thank you, Dr. Rapsilber, for being here.
Thank you as well. And to the audience out there, push play.